This baby, who was born with her organs in a frail sac sitting on top of her tummy, will soon undergo life-changing surgery as a result of her inside-out birth. Nell Marshall was born with her colon, liver, and stomach on the outside of her body. She was the lone survivor of a set of triplets, and she was the only one to survive. Because she has a unique ailment in which her organs are contained in a bag of skin called an exomphalos that is solely tethered to her belly button, she may have died if the sac had ruptured during birth, which is what happened. Nell, who has just celebrated her first birthday, is set to undergo an operation that will allow her organs to be transplanted back into her body. Seen here with her mother Joanne, 35, she will undergo that life-altering surgery in the near future. Nell was born with her bowels, liver, and stomach contained in a bag of skin known as an exomphalos, which was only linked to her belly button at the time of her birth. It was informed to her mother Joanne of Hexham, Northumberland, that her daughter Nell might require surgery shortly after birth. The exomphalos is essentially just a bag made of extremely thin skin from the umbilical cord. Mrs. Marshall, 35, described it as follows. We were informed that it could rupture and that Nell would require rapid surgery to keep her organs sterile. This was fortunate in not transpiring. A year later, her organs are still contained within the small bag of skin that covers the outside of her belly, which was taped to her stomach in order for the skin to grow over it. When the baby's abdominal wall weakens, where the umbilical cord attaches to it, it allows the baby's organs to protrude outside the body in a loose bag that surrounds the umbilical cord, a condition known as exomphalos. The disorder affects around 1 out of every 5,000 children. It is estimated that almost half of all kids with this will have difficulties affecting their other body systems, and Nell was diagnosed with an aortopulmonary window, a hole in her heart, at the age of just a few weeks old. In fact, Nell's disease is extremely unusual, accounting for only 0.1% of all congenital cardiac anomalies. She had to undergo a surgery in which surgeons repaired the hole in her heart with pig skin, which was extremely difficult. At first, the exomphalos was the most serious problem, but when we discovered the hole, that became the number one priority, Mrs. Marshall explained. The physicians informed me that it was a highly rare ailment and that they hadn't seen anything like it in 30 years. They made fun of the fact that they had to use textbooks from the 1970s to treat Nell, but the operation was a success, says the doctor. The staff at both the Royal Victoria Infirmary in Melbourne and the Freeman Hospital in Newcastle were just fantastic, and I don't know how we could ever express our gratitude to them sufficiently. Mrs. Marshall and her husband Andrew, 45, a spray painter, were permitted to take Nell home with them after 3 months in the hospital after dealing with the heart condition. Her exomphalos, though, remained. It was explained to the family that Nell needed to grow before she could endure the invasive operation that would cure her ailment, so they've been coping with her condition for a year. It is expected that Nell will have the operation to move her organs back into their proper positions on May 19th. She has 3 elder siblings, Amy, 12, James, 8, and Iris, 3. Mrs. Marshall, who works as the manager of a playgroup, expressed concern about Nell having to go through with the surgery. We spent the first 3 months of Nell's life in the hospital because she had a hole in her heart that was repaired with pigskin. She had pneumonia, she had respiratory problems, and she had a slew of other challenges, she explained. What exomphalos is and how does it work? Exomphalos is a weakening in the baby's abdominal wall at the point where the umbilical cord connects to the baby's body. A result of this weakening, certain abdominal contents, principally the colon and liver, can protrude outside the abdominal cavity and into a loose sac that surrounds the umbilical cord where they are retained. Because the contents of the stomach are outside of the abdominal cavity frequently does not develop properly and remains small in size. The exact etiology of the tissue is unknown, and it is a rare problem that affects approximately 1 in every 5,000 pregnancies. Approximately half of all newborns born with exomphalos will experience difficulties with their other body systems. The size of the sac and the contents of the sac can vary widely, ranging from very little to quite enormous. As a result, until the baby is born, it will be hard to determine exactly what type of procedure will be required for exomphalos. As long as the exomphalos is tiny, it may be possible to replace it inside the abdominal cavity and heal the muscles and skin in a single procedure. It may not be possible to close the exomphalos in a single operation if the exomphalos is extremely large. As a result of being poked with tubes and needles, she developed an intense fear of touching her hands or putting anything in her mouth, and she is only now beginning to reclaim her former cheerful and smart self. Her little body will be covered in scars, as the case with all major surgeries, says the doctor. Since she was a newborn, she has continued to have issues with her throat and is fed through the intravenous IV catheter. While the long-term ramifications will be with Nell for the rest of her life, she came so close to losing her life that we are going to do everything we can to make her life as wonderful as possible. I will endeavor to ensure that she has a positive body image and that she learns to seize life by the horns, she says. Nell, on the other hand, has proven herself to be a survivor despite her close call with death. Despite everything she's gone through, she has never given up and has maintained a grin throughout it all, Mrs. Marshall said. Exomphalos is a condition that occurs for unknown reasons. The exact etiology of this rare issue is unknown, and it is a rare problem that affects approximately 1 in every 5,000 pregnancies. Approximately half of all newborns born with exomphalos will experience difficulties with their other body systems. The heart, lungs, and kidneys are the organs that are most usually damaged. Even though thorough scans will be carried out, it will not always be feasible to discover issues before the baby is delivered. A chromosomal issue is also a possibility, and an amniocentesis will be performed as a precaution. What happens after the package is delivered? Unless the exomphalos is extremely large or there are other factors that need a cesarean section, you should be able to deliver your baby in a traditional manner. Although it is not required, we would suggest that your baby be born here at the Princess Anne Hospital. It is likely that your kid will be sent to neonatal unit shortly after birth. The first course of action. Your baby's birth sac will be covered in a protective film to help decrease heat and fluid loss throughout the delivery process. A drip will be inserted into a tiny vein to allow for the administration of intravenous fluids. It will be necessary to insert a tube through your baby's nose and into his or her stomach in order to drain away the green fluid or bile that is accumulated in the stomach. This decreases the likelihood of your infant vomiting as well as his or her pain. Your child will be evaluated to determine whether there are any abnormalities with other body systems, and he or she may require more tests. If there are accompanying lung difficulties, it is possible that aid with breathing will be necessary. Surgery. The size of the sac and the contents of the sac can vary widely, ranging from very little to quite enormous. As a result, it is impossible to predict with certainty what type of operation will be performed for exomphalos until your baby is born and the precise size of the tumor can be determined. Although there are several various therapies available, the choice of which one to choose will rely on the size of the exomphalos in question. These are the ones. Primary repair. If the exomphalos is tiny, it may be possible to replace it inside the abdominal cavity and heal the muscles and skin in a single procedure. If the exomphalos is exceedingly large, it may not be possible to close it in a single operation. In this case, staged repair may be necessary. As a result, the baby would require an initial operation to establish a temporary envelope of plastic sheeting, silo, outside of the abdominal to protect him from infection. The silo would then be gradually reduced in size over a period of approximately 10 to 14 days, resulting in the abdominal contents being gradually forced back into the abdomen. In most cases, this will be done on the ward under general anesthesia as needed. A last operation is required to entirely replace the abdominal contents and to heal the muscles and skin that have been damaged. If the closure is too tight, the infant may need to be placed on a ventilator for a few days to assist with his or her respiration. An abdominal skin closure over the exomphalos may be sufficient, and the muscles need not be repaired, if the surgeon so chooses. If your infant suffers from this, he or she will develop a ventral hernia, a bulge in the stomach wall, which will necessitate another procedure to fix the hernia at the age of approximately 3 years. In the interim, your child should be able to return home and have a regular life while awaiting the second operation. Painkillers will be administered as needed for all of these operations. Conservative treatment. If the exomphalos is very large, it may not be possible to close it until your baby is older and the size of the abdominal cavity has grown. If the exomphalos is small, it may be possible to shut it with surgery. Several weeks or months will pass before skin begins to develop over the exomphalos and cover it completely. It is possible that your kid will be able to return home before the exomphalos has been completely covered by skin. Your infant will be left with a ventral hernia as a result of this sort of procedure, which will be fixed when he or she is about 3 years old. If your baby has this issue, the length of time that he or she will stay in the hospital will vary depending on the type of treatment required and the presence of any abnormalities affecting other body systems. If there is a danger to the baby's life in this situation. Babies with this syndrome have a poor prognosis, which is dependent on the presence and the severity of any other connected illnesses. These issues aren't always apparent until after the child is born, which is unfortunate. The vast majority of babies born with only an exomphalos survive and go on to lead normal lives as they grow older. Is it okay for me to feed my baby? The bowels of some newborns with exomphalos can return to normal function within a few days following their operation. However, the bowels of other kids with exomphalos can take many weeks to return to normal function. During this time, your baby will require drip feeds, paternal nutrition, which will be administered through a lengthy line. Most of the time, the line is put in a tiny vein in the arm or leg and then fed through to a larger vein. It may be essential to do a surgery under anesthesia in order to place the line directly into a large vein.